All right, so that's the end of the video sharing session. So hi everyone, good evening. Great to have you all here with us tonight. And to our Malay participants who are joining, selamat berbuka puasa. And to our other participants as well, thank you so much for taking the time to join us, given that it's almost, dinner time. So before we officially begin, I'd like to kick things off with a quick poll. So can we have the first poll up, please? Right, so the question here is, have you experienced one of these, stress, anxiety, or depression during the COVID-19 pandemic? Right, a majority of responses are responding yes. All right, so it seems that a majority here, which is 69%, has said that all of you have either experienced one of these during the COVID-19 pandemic. All right, so hi everyone, welcome to our 5th Thursday Mental Health Talk. And tonight's topic is on coping with stress, anxiety, and depression during the COVID-19 pandemic. So before we officially begin, I would like to introduce myself. So hi, I'm Sharvina. I'll be facilitating the session for tonight. So I've always been very interested in the human mind and its psychological constructs, which is what motivated me to pursue a degree in psychology, which I graduated with last year. And I've been serving with the Rotary team in developing the initiatives and for the official launch for the National Coalition of Mental Wellbeing. So what is it exactly that we do? So can we have the slides up, please? Right, thank you. So basically, we are a group of individuals, non-governmental organizations, public institutions, tertiary educations, and companies whom are dedicated towards championing the cause on mental health. So we focus on 4 primary areas, which include, firstly, fighting stigma and discrimination, suicide prevention, mental and emotional wellness promotion, and the very last one, youth and adolescent care. So next up, I'm going to invite Dr. Dixon, who is currently the chairperson of the ICT task force, to further brief us on the latest developments for NCMW. Hi, Dr. Dixon, the floor is all yours.
Hi, thank you. Thank you, Shavina. Good evening, everyone. It's a great pleasure for me to update everyone the progress of our National Coalition of Mental Wellbeing. There are total numbers of 10 task force at this moment, and it will be quite difficult for me to go through all the details. So therefore, I only selectively update some of the key activities that have been ongoing and what are upcoming event is going to happen soon. First, Youth and Adolescent Task Force. We have got the endorsement from Ministry of Education to train school counselors throughout Malaysia, I mean the whole country. Now, it will be a very selective counselor from every state. Now, the team at this moment are working on finalizing the training materials and content. So they are targeting to initiate this in early May or during May at 2021. So look out for this Youth and Adolescent Task Force, which they're going to carry out the training to the counselors in the school. Second, discriminalization. So now the team are working on the launch. The team are working on the launch of official launch of National Coalition of Mental Wellbeing, and they are targeting this to be in July 2021. This is an exciting milestone. We're going to launch this officially, so look out also for the updates. We will keep you updated on the next third Thursday talk. Okay. Fourth, the communication team. Very exciting team. Right? They are planning a series of content and also information to be released at social media and also public. Now, we might not hear from them at this moment. We thought that they are very quiet. In fact, this team, there are a bunch of hard workers who is voluntarily to create a lot of contents at the back, right, silently behind the scene. So soon they're going to release a lot of information to the public. So look out for this. And this is going to be, they are going to create a maximum awareness to the public. So take note of this. You might see the familiar logo that's going on in the social media. Now, last but not least, right, which I'm currently heading the ICT. So I would like to announce two things. First, the official website will be ready by end of this month, or in the next 2 weeks, it will be launched officially, and you will be able to log into the website, all this, right? So it will be soon released. So take note of that, and domain name will be showcased once we finalize it. Right? Second, I would like to take this opportunity to continuously promote our third Thursday talk. Right? This has been our 5th, and we have lined up for the 6th, for the 7th, for the 8th, for the 9th, for the 10th. And it's going to continue for the next 3-4 months for the entire year. So please stay tuned with us. Right? A series of good speakers and a nice topic is all related to mental health. So thank you very much, and I pass back to the moderator, Shavina.
Thank you so much, Dr. Dixon, for the thorough briefing. So I'm sure that you guys are very keen to meet our moderator for tonight, who shall be moderating the very, very interesting conversation between our two prominent speakers. So our moderator for tonight is, I would have factored in a drum roll, but unfortunately we don't have a background sound effects team. So looks like we're gonna have to go with an imaginative drum roll instead. So our moderator for tonight is Rajiv Matthews. So a little bit of background on Rajiv. Rajiv is a leadership coach and a director of Harvest Global Resource. And in his practice, he capitalizes upon mental wellness as a tool in order to improve the performance and development of his clients. So Rajiv is also the current chairperson for the Workplace Task Force under the National Coalition for Mental Wellbeing. So let's all give Rajiv a warm and hearty welcome. And Rajiv, the floor is all yours.
Thank you, Sharvina. Welcome, everyone. Good evening. Great to see all of you here today. I think it's a very interesting journey because COVID, the pandemic, has been part of our lives. And to tell you the truth, it is not going to go away for a long time. We have to live through this, and history will be made. It is about how we are going to manage through. It is not about surviving, but it is about how we thrive through this pandemic journey. And in our research, we wanted to find people who have actually experienced the COVID very closely. And we chose our first speaker, Dr. Anand Kamalanathan, who's garnered vast experience across his career in the Queen Elizabeth University Malaya Medical Center and Sungai Buloh hospitals. He's currently a clinical fellow in the cardiothoracic anesthetic at the National Heart Institute. A bit about Dr. Anand. He is also the recipient of the Saim Darby Bersama 2.0 award. He's also had his research paper, a survey on burnout and depression, risk among anesthesiologists during COVID-19, recently published. And he has additionally presented his research in Seoul and in many local and intensive care conferences. He's also featured in an interview on BFM and domain of health and living, Doctor in the House, burnout among anesthesiologists during COVID-19. He has an impressive list. He's a board member in many associations. And he also, he loves to travel. He loves cuisines. So he's a normal gentleman. And he's a avid tennis fan and also passionate MU supporter. Now, I think the mystery speaker for today is Dr. Ahmad Shahir bin Fadzil from Petaling Jaya. We chose him as a mystery speaker. He's not here yet. We are waiting for him. He is a graduate of the Segi University 2017. And he did his HO in Sultana Amina 2 years in Johor, and then MO for 1 year, and he moved to Sungai Buloh Hospital. Now, the reason we made him mystery speaker is because he was a COVID patient, right? And I think it is be very good to hear from him, his experiences. And first of all, I would like to invite Dr. Anand to come in to the panel.
Hi, everyone. Thank you, Mr. Rajiv and the Rotary Malaysia, as well as the National Coalition for Mental Wellbeing, for giving me this opportunity to share a little bit about myself, my story, and my experiences in Hospital Sungai Buloh.
Okay, great. Thank you for coming. We first of all salute you because you are one of the frontliners who are serving our country. We are very thankful and we are very grateful. Let's give a round of applause. Yeah. And it's amazing to see young doctors who's leading all of us through this trials and tribulations. And okay, so I think, Anand, I think we will go directly into the topic. And so tell me, what is your experiences in a summary before I go into the questions? How did you manage this whole pandemic?
Well, that's a very interesting question, and it's not something that I can easily answer. Well, I didn't manage this pandemic by myself. I was part of an amazing team of doctors in Hospital Sungai Buloh. So I'm an anesthesiologist. We work in the intensive care unit, and we manage the most critically ill COVID patients that have been admitted in our hospital. So Sungai Buloh, I think, manages about 30 to 40% of the total number of COVID patients in the entire country. It is the largest COVID hospital we have in Malaysia, and it's the National Referral Center for Infectious Disease as well. So it's been an honor to be part of that team. I just recently left Sungai Buloh in February, as you have mentioned, and I joined IJN to pursue my fellowship.
Okay, great. Okay, so I understand you believe teamwork works, and it is teamwork that brings about. But what about being an individual? What are some of the thoughts that go through your mind daily? Because you are actually meeting COVID patients every day. And what type of stress or challenges do you go through, or you don't have any challenges?
Oh, of course. Of course, we have many different challenges. But before I continue, please allow me to state a few disclaimers. I'm not an expert in the field of mental well-being. I'm not a psychologist or a psychiatrist, like our lovely invigilator, Ms. Sharvina. In fact, some of my psychiatric colleagues have even said that I would be a terrible psychiatrist simply because I talk more than I listen. But I do have experiences handling patients in this past 1 year who have been infected by COVID, and it's a totally different ball game compared to the other types of patients and the stresses that I faced managing normal patients 10 years before. So when we talk about management of stress, basically it's when pressure placed on an individual exceeds their perceived capacity to cope. So the two key words here that I found is pressure and your ability to cope. So COVID-19 has given us this extremely extra pressure on us to perform and on us to work as individuals, as part of a team. And it has reduced our coping mechanisms by, inducing lockdowns, removing our ability to go out and meet people and reduce our stress. So for me personally, the three main domains that were affected were my personal life, my professional life, and my social life. Personally, I felt in the beginning of this pandemic, there was a lot of uncertainty about this disease. It was a novel disease, a new completely disease that we have never faced before. and we had not much of prior knowledge to apply. So for example, if someone comes in with diabetes, we know what to treat it with, like with insulin, with drugs to reduce blood sugar. But when COVID came in, it came with a barrage of symptoms and signs, and we did not know what drug would help. And this caused a lot of anxiety on ourselves, because patients were coming in so fast and furiously ill, and we did not have the adequate amount of time to learn by ourselves. So what we had to do was we had to look at what countries abroad, because Malaysia did get the disease first. Thankfully, we had the archives from Italy and China, and we could look at what they were doing. But still, even in their experience, it was still relatively new. The next stress personally that I felt was, what if I contracted the disease? Early March, April 2020, there were lots of reports coming out from China as well as Italy on a lot of healthcare workers being infected by the virus itself. And so when I put on my shoes and pants and I went up to work, this thought, this niggling thought, just was in the back of my mind, despite the PPEs that the government had provided, despite the safety protocols that we were doing, it's still in the back of your head that, what if I get this, and what's going to happen to me? What's going to happen to the people that depend on me? And then the other personal issue or the factor that affected my personal life would be the impact of lockdown. So what I experienced was, I went to work, we worked the whole day. It was such a difficult time for us. And when we come back, because of the lockdowns, there was no outlet for us to reduce our stress. For example, we could not go out, we could not exercise. There was no work-life balance. Now, I do not mean to compare or to create a controversy by comparing my profession with others. I'm sure each of us had our own dilemmas. Each of us had our own trials and tribulations throughout the pandemic, and each of our experiences would differ. And hence our response towards this pandemic as well would differ. So I can only share my story and state that this affected us in a very personal way, as well as our professional life. So in short, I would say our personal life was affected, our work was affected, and our social circle was affected as well.
Great. I think that is great sharing. I think we also go through the same things.
Yes.
And I think one of the things you pointed out is the knowledge, right? Knowledge of what is happening, we do not know. And of course, our WhatsApp and our messages were full of information. We are not sure which information is correct. And there were a lot of different theories. And the second part, you said, yeah, there was stress and you wanted an outlet to release it, and then you are stuck because you cannot go out. So I hear a few things. One is to have a proper life balance even would be very good, right?
Yes, definitely.
And I think the other thing is knowledge. How do we know what is the truth about COVID, right? Even now, there are so many theories flying out. And what do you suggest the audience do? Because anxiety comes from the fear of what is happening, right? We are not clear. So what would be some of the things that you would recommend that we in the audience do?
Right. So one of the main issues whenever you're facing something new, uncertainties, is information overload. You will be getting some messages from your uncles and your aunties who will receive some forwarded messages from their friends. And then you'll get some knowledge from your father and your mother and your great uncles and your great aunties. And then you have colleagues who are sharing lots of different information, which is difficult to streamline. So I would always say, trust one source, your main source, which is your Kementerian Kesihatan Malaysia. Whenever it comes to information about COVID, they're pretty up to date. In fact, every day they update us on the number of cases the number of critically ill patients in ICU, the number of patients who have died. It's pretty accurate, and information on COVID and its vaccinations and the side effects and what's new with the treatment is all available on your My Sejahtera as well. The other important information source would definitely be from your WHO, the CDC United States. I would refrain from visiting sites that are opinion-based. So whenever you visit internet sites and you see that it's not from a verified source, then you can be sure not to take too much of that with a pinch of salt.
Okay, all right, great. I think this is a confirmation of what we really need to do, because there's we are dragged into a lot of information every day, even now. Now there are questions about variants and all that. Okay, so my question is, yeah, now you see the stress, you see some of these challenges. What are some of the things you have done for yourself to overcome this? Because you still have to go to work every day, right?
Yes. So when it comes to healthcare workers, I think stress can work two ways. It's either eustress, which makes you perform better, but when it exceeds your capacity to cope, then it becomes distress. So the first thing when you're facing a workplace or workforce is a recognition of the disease, or recognition that there is a problem out there. And the only way to do that is to study the prevalence of the disease. So I was very interested on how we can capture data, and that's why I did this study called the Burnout Trial. So we did it in May to June 2020, and our aim was to see how many of the healthcare workers in the primary, tertiary COVID center in Malaysia were actually diagnosed or were actually going through a risk of depression, stress, and burnout. So to do that, we used this internationally validated questionnaire. It's called the Maslach's Burnout Inventory. And then to also look at the risk of depression, we used Prime MD, another questionnaire that's been validated internationally in many journals. Our target was the entire Department of Anesthesiology and Intensive Care. I think we had about 100 over doctors, medical officers, specialists, consultants. And astonishingly, but not unsurprisingly, more than 50% came back with the result of burnout syndrome, and more than 67% had a high risk of depression. So now we have this data, we have evidence, we have objective evidence to say that this subset of healthcare workers are going through the problem. What next? Then we need to see if we can help other populations out there by detecting what are the risk factors that differentiate this healthcare worker with the other. Why does this particular healthcare worker seem to be having burnout versus the other? So we looked at demographical data. We looked at the age. We wanted to see if the older the doctor or nurse or medical officer, would they be more experienced and be more able to handle the pandemic? Or would the younger, more inexperienced, immature person be at higher risk? And we found that age did not play a part. Both age and gender did not play a part in deciding who was a higher risk factor. This was very interesting because it means that everybody is susceptible to burnout syndrome. Every race, every gender, every person has the potential of being depressed or getting the risk of depression or being burnt out. And then the next thing we tried to do was to look at other researchers to see how other governments, other countries were implementing their mental well-being program. How were they resolving this burnout syndrome? And what we suggested in my paper was to have a three-pronged approach. We needed national, above our pay grade orders. We needed that kind of intervention. We needed a departmental hospital intervention. And we needed an intervention at the level of the individual itself. So if we have some time, allow me to explain what I mean by the three-pronged approach. From the national perspective, I think it doesn't matter if you're a doctor or if you're a lawyer or if you're any other profession, your national body, your national representative body has to make you feel protected. Because when you feel safe, you can function better. So our initial anxiety was because there was word out there that the country did not have enough personal protective equipment. We were worried that if we had to go out and face this disease without the necessary protection, then we would, contract the disease. And this was playing in the back of our mind. So the government or the national body or whichever association that represents your profession should protect your profession by allocating adequate manpower, allocating adequate personal protective equipment, as well as increasing budgetary allowances if it's possible. From the departmental point of view, and this comes from the organizational structure of your workforce, the people in charge need to appoint a person who is solely in charge of the mental well-being of the department, meaning there's a mental well-being officer whose sole job is probably to assess what is their mental capacity of this particular person on a weekly basis. Because when you're having a high stress environment coupled with a person who's unable to cope, and then that's a recipe for disaster. So what happened in my workplace is there are doctors and healthcare workers who are not fit for COVID duty. For example, they have some comorbidities, they are ill, they are elderly, or they may be pregnant. So we excluded these people who were part of our hospital and team from doing COVID duties. But what we made them do instead was to make sure they looked after the welfare of the entire department. So they ensured that we had adequate beds, adequate rest areas, food stocked in case we only had our meals after midnight. There was this dedicated team ensuring wellness of the entire department. And we found that greatly improved the morale, because when you're well fed and you're well rested, you can perform better. We also found that improving morale among your healthcare workers or your department boosted efficiency and boosted the way our colleagues approached their work. It was very noticeable when members of the public or recovered patients, even from our Permaisuri Agong herself, they all came, gave us gifts, gave us food. It sort of validated whatever hard work people were doing. And when you have validation of the work that you're doing, your mental well-being improves. You feel like you're appreciated. And appreciation is very important to de-stress yourself from expectations. We also had this hospital psychological support system in which if anyone felt unduly stressed, you could always call up this number. But the number was always engaged, always full, because there was a high volume. Unfortunately, in Malaysia, in the Ministry of Health, we only have about 200 registered psychiatrists and a few other 100 psychologists as well. So we started outsourcing. I think many volunteers from the private sector, from the MIND faculty, from befrienders, they contacted our healthcare workers and said, hey, we are here. There's another avenue for you to express yourself. Please don't keep quiet. Please don't keep things to yourself and, express yourself. So that's from the department and organizational point of view. And from the individual perspective, I think resilience building is very important. The first thing I keep telling my colleagues and my co-workers is that it's okay not to be okay. It's normal to feel stressed, anxious, and feeling burnt out. But it's not okay if you keep it to yourself. Now, with the lockdown and with the social distancing rules, yes, talking to people and meeting face to face, something that was part of our history in the way we cope, in the way we de-stress, it was taken away. So we needed to adapt. And thankfully, the world was adapting as well. Zoom started to become a bit more popular. WhatsApp family calls became available, and we had many more social and virtual methods of meeting other people so that we could de-stress. And I think talking about your feelings and not bottling up is a very important aspect of how an individual is able to tackle and de-stress. And finally, I think recharging is very important. When expectations are placed upon you and you have no time to rest or recharge, you sort of lose your battle fire. You sort of lose. It's normal. I mean, it's human that if you're being pushed to the limit on every single day for a very long time, you would lose that motivation. So I think taking a break, stepping back, going on a well-deserved holiday, be it just at home or away from your workplace, is very important so that you can rest and come back recharged and probably improve on your performance.
Wow, that's quite a bit of information.
Yeah, I'm sorry I talk a lot.
No, it's okay. I think those are valuable information. And I think one of the things that I picked up is it's very good to know what is happening in the hospitals. I like the part of having well-being officers assigned to look after the welfare of the people. And I think the other point was validation, that we need to validate and support people in the process, and also to recharge. I think it's very good. I'm very curious to know, as the patients come into the hospital, they are also stressed and anxious. What are some of the things possibly you do? I mean, my God, it's freaking out when they walk into the hospital knowing that they have COVID. Is there any type of support they receive in the hospital?
So I think it's a bit difficult in the COVID setting because family members are not allowed to visit them. So they have this additional stress factor where they themselves are alone. They are in isolation boxes in which maybe 5 times a day, a nurse or a doctor comes in to just check on how they are and leaves, and then they're back alone and isolated again. So having spoken to a lot of patients over this past 1 year, their main issue is that they don't have an outlet. And sometimes, even though WhatsApp is available and they have their handphones with them, I'm talking about the ones that are well and are able to function with their phones. Even though it's available, but it's just not the same as a human touch. And with COVID, doctors and nurses alike have sort of had to reduce the amount of contact we've had with patients for our own protection, and it sort of made us have this substandard care if we compare to pre-COVID days, where we would sit for hours and reassure a patient, hold their hand. We sort of had to cut down on all of that because of the of trying to reduce contact time with infectious patients. And then when it comes to ICU patients, these are patients who are so critically ill. And this is the subset that I have been working with more than the ones that are awake and well. These are patients that can't breathe. So they have a tube inserted into their mouth, and they are connected to machines that support their heart, their lungs, their kidneys. So these are a completely different set of patients that are not responsive. They're not awake because they're comatose. Then it doesn't become an issue with the patient, but it's more of their family members. The family members can't contact them. So they are at home, they are worried. There's no news for the whole day. And critically ill patients, their conditions can change on an hourly or even 30 minutes basis. So we have got a different subset now, the family members who are anxious stressed, probably much more than all of us, or equally, if I can say. And we've had to learn how to manage these patients as well, because it's very difficult for us when we have 60 patients in our ICUs. Each patient has a brother, has a wife, has an uncle, has an auntie, has a father, has a mother, and each of them want to know what's happening. So we've sort of had to, over experience, over time, we've sort of had to learn how not only to comfort patients, but also their family members, which is a very difficult thing. And I don't think we have completely succeeded. It's still a learning process. Sure. And we hope that we find better ways in dealing with families, especially.
Wow, it's amazing things you're managing to do. I want to check with the facilitator if Dr. Ahmad Fadzil is here.
Yes, he's in.
Okay, all right.
Yeah, I'm here.
Can spotlight. Hello,
hello.
How are you?
Can you hear me?
Yes, can hear you. How are you doing?
I'm fine, thank you.
Hey,
Hi, Tahir, how are you?
Thanks for finding time to come here, especially during the fasting month, and trying to give us some information. I'm sure you heard the conversation.
Yeah.
When did you actually become a COVID patient?
Okay, first of all, I would like to thank from the Rotary for having me tonight. So I was infected by COVID on 21st of November.
Okay.
Yeah. Right. Subsequently, I had symptoms on that day, and then after 2 days, I decided to take a swab, and turned out to be positive on the 24th of November, and I was admitted. Okay. Yeah.
And what went through you? What kind of challenges went through your mind, and fears or anxiety?
Yeah, the whole incident is quite overwhelmed to me, in which I have in my mind there are three things that I always think about. The first one is myself and my families, and also my colleagues.
Sure.
Yeah, as a healthcare worker, I've seen a lot of patients, any kind of patients, in which from stable and suddenly become deteriorated and goes down to the south. So that makes me very, very worried of myself. And I always think, initially, I always think negative towards it.
Okay.
Yeah. And the second thing is, I worried of my families and my colleagues. These are making me very stressful.
Sure.
And guilt also.
Okay.
Yeah. So unfortunately, on the day that I had symptoms, all my families are gathering in my parents' house. So all of us have to swap, and thank God, only my others are negative, but only my father's admitted with me.
Oh.
Yeah.
Okay.
So I was very worried, and no one is taking care of my mother at that time, because I live with my parents, and once my father is admitted, so no one was taking care of my mother. So I was really, really worried of her for staying alone, and she's a bit anxious as well.
Okay.
The last thing is regarding my colleagues. So once I noted to be positive, then I had some contacts during my work in the department, and I've been informed that all of them has been swabbed. So in the back of my mind, I was worried that am I gonna cause the department to collapse, or anyone getting positive. So yeah, that makes me worried also. Yeah, luckily no one is positive at that time lah. Yeah.
Okay. So, Dr. Ahmad, what can you tell to the audience of how to manage some of this fears and worries, because you went through those things, right? And
Yeah.
how can you see it positively? And what do you want to tell the people? What can we do, right? Because any of us can be the next one, right? And if you are careful, and what did you do to get this, right? I'm sure you are well protected all the time. What is it that you didn't do to get it?
Okay. So first thing is we have to have a good mindset. Okay. So when things happen, please remember that anything happen, it's not the end of the life. So there will be light towards the end of the anything that happens. Yeah.
Okay.
So you just have to think positive, and you are not alone in this thing, and you will get help from from healthcare workers, from families, from your friends. Any simple kind of act will motivates towards positive thinking. Yeah.
Okay. Wow, that is very enriching to hear from someone who has come out. And I want to ask this directly. We have continuously heard this information on WhatsApp and everywhere, but I want to seek your advice. What do we need to do exactly so that we don't become a COVID patient? And you are a doctor, so you tell us.
Yeah.
We want to hear from you.
So we heard a lot of news information every day. Same thing going on and on. Wear masks, hand hygiene, social distancing. But do we really practice it outside? Do we really alert about this matter? I've seen people memang 100% they are wearing a face mask, but that doesn't mean they are following the SOPs. Just because only scanning the MySejahtera and then temperature checking, that doesn't mean you are really following the SOPs. What you have to do is we have to be alert and analyzing the surroundings. Let's say, please avoid the crowded places and keep distance to each other. I don't think 1 meter is enough, but at least we have to keep 2 meters, especially those who are having symptoms like coughing, sneezing, and I don't really agree with cloth face mask. Yeah, that is not really reliable. So the surgical face mask is the 3-ply is quite effective. And also practice hand hygiene, which is before and after you touch anything outside.
Okay.
Yeah, so I just enforce the SOPs. Nothing new so much.
Yeah, but I think we want to hear from someone who went through it.
Yeah.
I'm assuming that you probably missed one of this to get the COVID.
I don't know. Actually, honestly, I don't know where did I get it from. Either from the communities, families, or my workplace, or any breach of my PPEs. So yeah, until now, I'm asking myself, how did I get it?
Yeah. Okay. You know, right now, I think we are a bit loose to go out. We are trying to meet our friends for food, for dinner,
Yes.
and all that. And I noticed that there's nowhere that they meet this 1 meter kind of thing. And we really do not know who is coughing. right? We really
Yeah.
do not know out there. And I see also the mask is sometimes not fully worn, all kind of different things. So
Yes.
I think you have re-emphasized the need.
Yeah.
And anything else you think that can help us to remain motivated? Because I think this is going to be there for a longer period, right?
In my opinion, this thing, we have to think of ourselves. Uh, do we really have the integration of ourselves? We have to be integrated, and also we cannot simply be a selfish. And we I understand that we aware that the case is still high in numbers, so we cannot take it for granted if there is any reducing case.
Mm.
So we have to uh, think hard of this as a serious matter
Mm.
for us to get back our good life.
Mm.
So yeah, that's what I think.
What do you mean by we need to be integrated?
uh what I mean is, we know that this SOP is not being monitored very closely 24/7. So it is on our job, to make sure that our we have been honest to ourselves and the community.
Mm.
Yeah.
Okay, so I think we need to take responsibility,
Yes.
right? Okay, wow, that's fantastic. So it's a good reminder for today's meeting. Let me call, can I have Dr. Anand back? Okay.
Sure, glad to be
So,
back.
yeah, good. So, Dr. Anand, now both of you can share what are your thoughts. I think now as we are coming back, I think you have shared some very important information that is going to be very helpful to us. And thanks for sharing what is happening in the hospital and all those issues. And what would be some of your closing statements for us?
Okay. I think we all know that this pandemic is far from over, and just as we think things are under control, today the numbers are astoundingly high. It's about 1,008 again. We still have more than 200 patients in the ICU. So until we have got a hold of the situation, I think we cannot let our guards down. We need to be constantly vigilant about our surroundings, about the people we meet. We need to, practice the normal SOPs. Like Shahir said, you need to be honest, you need to be careful, you need to be safe, protect your loved ones. If you do not fear the disease, if you're young and you do not think that it will affect you, fear that you may spread it to your loved ones who are old, elderly, and high risk. Many people I've met are just nonchalant and are not worried at all. That's fine. It's been proven that the young very rarely get very, very severe side effects, just like Dr. Shahir himself. But what we are worried about is the high-risk population, the at-risk population, which are your parents, your uncles, your aunties, your grandparents, or even your brothers and sisters and cousins who have severe comorbids like diabetes, obesity, hypertension. These are the risk group that we are trying to protect so dearly. So if you do not worry about yourself, worry about your loved ones. And if you can, please sign up to get vaccinated.
Okay. All right. I think we are all, some of us are registered. We are waiting patiently. So we are just wondering when it is going to happen, right? But
beyond my control.
yeah, I think it is a different thing. What would be I think maybe is to going back to Dr. Ahmad, what would be some of the things that you would suggest that I know you told keep in touch with your family, friends, but how do you remain positive? It's very difficult. You know, I'm like thinking about the moment I know, suppose I go to the hospital and I did a test and I found that I'm COVID positive. I think I will be brokenhearted, right? And how do I manage from there? I don't even know what to do. Can you share the process a bit from the, because my anxiety and fear starts from there.
Okay, I try to enlighten everyone. Uh, I understand that this thing is very overwhelmed, and once you get COVID, you definitely will have some mental issues. You know, you should definitely feeling stressed, fearful, anxious. It's not. It is normal to feel like in that way. It's not a matter of how you feel, but it's a matter of how you get back on track and set and orientate yourself, and make sure you have a good mindset.
Okay.
So when this happen, there's a few factors that come into roles. Firstly is yourself. You have to be strong, and then the second one, surrounding you is playing important role. Like myself, my friends keep asking me how am I doing, keep sending me foods. So in a sense, in that way, I feel like, okay, I cannot lose this battle. I have to be strong. Other than that, family also is very important. Like I'm a Muslim, so my mom continuously pray for me every day and night. So the because after 8 days of admission, my condition get a bit of worsen,
Mm.
but my oxygenation is okay. So they did a lot of things to me. So long story short, my family getting worried, so uh, they pray for me very hard. So in that way, I feel like spiritually and mentally stronger.
Mm.
Other than that, my superiors, my consultants also had asked me how am I doing. So they also give some motivation to me so that I could be straight of my mind. Last but not least, I like how Sungai Buloh Psychiatric Department manage these COVID patients. In the wards, there is each of the rooms, there will be a QR code if the patient need helps from the psychiatrist or psychiatric doctor.
Mm.
So we just have to scan. Let's say you have someone to talk to, you have something in your mind that you don't want to talk to anybody, so you just have to scan the QR code and just fill up some informations, and after a while the doctor will call you straight away and asking you and talk to you, how are you doing. So I feel that that way is helping the patients to avoid the stress and anxieties, you know.
Wow, that is
Yeah.
fantastic news.
Yeah,
I never heard
honestly,
about.
I had scanned the QR code and I've talked to the psychiatrist.
Okay.
Yeah,
Well, I think being a doctor, you knew some of the facilities, but I've
yeah,
never heard that this was available. And I think that is something great because the like Dr. Anand said, we are alone, right? When we get admitted, no one to talk to.
Yeah.
And I think that creates some depression for us. And so I think that is fantastic news. I have a question, and it might not be, the thing is, what can, as we come into the hospital as patients, how can we be more tolerant and be more patient? What can we do to be better, to make the life of doctors better? Because you are also doing a battle, right? So what can we do? I mean, we are aware that, I mean, we have our own anxiety and fears. What are some of the things that we can do better?
You mean for COVID
Once we,
patients?
yeah,
Or
once we get admitted,
okay.
right? What are some
Okay.
of the things that we can consider doing to support your work in the hospital?
All right. Okay. So once you are COVID patients and you have been admitted, uh you have COVID patients have to understand sometimes they feel that they are left out in the wards, but it's actually I understand that the doctors in the ward trying to minimize the exposure so that the healthcare worker doesn't expose too much to the COVID virus.
Mm.
So I usually heard that patients complain uh, not getting treated well. Like some of the patients, the doctors only uh, at the door and ask how are you doing and everything. So I want COVID patients to understand that you have to be strong and let the you don't worry about getting left out. I am sure that all the doctors are giving 100% to help you and getting out from the hospital. Yeah.
Wow. Yeah, I think that's a good note to remember, that actually the hospital is there to actually to help you to come out, right? Right?
Yes, yes.
Yeah, I think that's a good note. Dr. Anand, anything you want to add?
Yeah, just adding on to what Shahir says, um, doctors are generally nice people. We are trying to help and cure your disease, and we want you to go back home. But in order to do that, what we expect is honesty. So there were a couple of incidences when patients were not being upright about what are the symptoms and their travel history, especially. And we found that very annoying and very disrespectful, because indirectly that was putting our lives at stake. Because when we deem you low risk, when you tell you have got no symptoms and you have not gone here or traveled here or gone for this big wedding or whatever, when you say you have not done that, we deem you low risk and we put you among the patients who we don't think have COVID. But then suddenly we find out that, oh no, this person lied. And that's a bit dangerous, not only for other patients, but for the healthcare workers as well. And I think this is the problem facing all healthcare workers in all hospitals that are screening patients nationwide, worldwide as well. We just expect some honesty. Yes. You can trust your doctor. We are bound by the Hippocratic Oath, and we're not going to divulge too much of information to the public.
Thank you very much. Okay, now I want to open up the question to the other facilitators who are actually monitoring the chat and the Facebook. So Terence and Mahendran, what questions do you have?
Actually, if you look at the chat, right, some of the headers are starting out with questions, so you'll be able to pick them up as well.
Okay, good evening, Rajiv.
Yeah.
You're able to hear me? Okay.
Yeah, hi, Terence.
All right. So a very good evening to all our participants today. So we have actually picked up a couple of your questions that you have been asking in the chat box, and I will relay them to our speakers right now. So question number one, with the increase of COVID-19 cases, I'm concerned about the psychological and overwork pressure on the frontliners. So are there any preventive measures in place? Any of the speakers would like to pick up on this? Dr. Fadzil, Dr. Anand?
Sure. I think what you're trying to ask is from an administrative point of view. And among the frontliners, you've got the top liners and you've got the bottom liners, such as us, me and Fadzil. So unfortunately, we don't make those kind of administrative decisions or are not privy to these kind of decisions. But however, we have a stake in it. And what we have been trying to propose is a sort of cohesion where everything comes together in one hospital like Sungai Buloh, and where we get people from different hospitals coming in to help us ease our workload. So providing proper and adequate manpower would definitely reduce the stress, the burden, and the physical workload. And if that can be done, I think that would take off the biggest burden that some of my colleagues in Sungai Buloh are facing right now.
So thank you, Dr. Anand. So from what we hear from you, it's a matter of increasing the number of manpower.
Yes.
Is that true?
Yes.
So would you say that we have a shortage in frontliners that are currently serving in the relevant hospitals?
Definitely. We have a shortage of skilled frontliners. Not to sound too discerning or disparaging of the efforts made by our government, but the entire focus on COVID last year and the efforts done last year have not been replicated so far this year. I think there's sort of been a lack of effort and a lack of interest in the repercussions this year. Most of the efforts are being focused towards the vaccination program. So most of the manpower, rightfully so, is being diverted towards the vaccination process. But what we are forgetting is that some of my colleagues in Sungai Buloh have been doing this day in, day out, wearing full PPEs for more than a year, working in suffocating conditions, and they have not had a break. They've not had an adequate break where they have just had this COVID-free time where they've gone out and done other work in other hospitals. They've not had that. And if I think they did, they would certainly appreciate and come back more refreshed and recharged.
Thank you for your response, Dr. Anand. And I hope Dr. Mustafa, you have your answer from Dr. Anand. And I think just now you have been mentioning a lot about the SOP, and right here in the chat, there's been a lot of mention of SOP as well. So I would like to quote a question, right? There are SOPs that are so simple to follow, yet we see breaches everywhere around us. Why? The period after school is especially scary. Parents are milling in numbers around the school gate without any regard to physical distancing. How can the school administration not be responsible for the basic public safety? So when we talk about SOP, we are urging people to follow SOP. Yet if we look at the public transportation, yet if we look at the public places like the schools, the colleges, due to the sheer number of people and a very limited space, it's pretty hard to follow SOP. And Dr. Fadzil just now earlier has mentioned about 1 meter is not enough. But over here, we don't even have 1 meter. So what do you say, Dr. Fadzil, Dr. Anand?
Okay, so regarding the SOPs, I'm sure everyone is aware of that SOPs that our government have been enforced. But then in this kind of occasion, places, it's very hard to control. So personally, I think it's still not a suitable time to start as has been asked, let's say the school, I think is, for myself, my opinion, I think it is not be ready yet to open a school, because the case are still ongoing and it's still a lot. It is very impossible to follow the SOPs in this kind of situations. Yeah.
Understood. Understood.
Mm.
How about you, Dr. Anand? Anything from you?
I think what we are seeing here mimics what has been going on in Europe, especially. If you read some of the reports, people are having this COVID fatigue, where they're just tired of following rules, tired of being limited from their daily activities, tired of the restrictions imposed onto them, when they feel that, you know, I'm young, I have a very low risk. If I get it, I'm in the hospital for 1 week and I'm out after 2 weeks. Why should I be restricting my life? This is the kind of dangerous thinking that has been reported overseas. And now we're sort of seeing this happening over in Malaysia as well. And speaking to the public, you can see that people are upset about the MCO. People are upset that they are not able to travel, they're not able to go on with their lives. And what's worrying is that the majority of people are fine. They have not been infected before. And this reinforces their belief that if they don't practice the MCO, the SOPs, they would still be safe. They would still not contract the virus. This is a very dangerous way of thinking. And I know quite a lot of people who believe and think this way as well. So we still have to educate the public, reinforce it, even though it sounds like a nagging elderly relative or a broken record. You know, when we keep saying follow your SOPs, follow your SOPs, it sounds like an elderly like my mother was nagging me. But I still feel that it needs to be repeated. It needs to be reinforced. And a bit more support from the administrators in terms of execution and in terms of the way it's being carried out should be done.
Thank you for the very insightful response from both of you. And again, I would like to relay another hotly debated topic in the chat, right? So from what I see over here, we are looking at 3 different angles. We are looking at the frontliners question. We are also looking at the SOP question. And there is one more topic that we have yet to tackle so far, which is the vaccine topic. So you see people has been discussing in the chat, right? So for example, Dr. Krishna has this question for our fellow panelists today, which is, would you agree that the best solution for Malaysia is for everyone to get vaccinated so that we can achieve an 80% herd immunity? Okay, and I would like to continue with the comment by Pak Kyung. The worst thing that can happen is that we are being forced to take the vaccines because it's believed that medical profession is against compulsion. But definitely, I think it's within the right of the nation to demand a vaccine certificate for travel. So you see, there's a lot of conflicting information out there in the public. I remember earlier reading about the deficit in trust, right? So in your opinion, fellow doctors, what is your opinion on vaccination? Should it be made compulsory? Are we able to achieve herd immunity? How about people who opt not to take it? What would be the consequences?
Okay, all very interesting questions, all very important insights. And it's a very ethical question to discuss as well. The issue of human rights, individual rights versus the rights of protecting the community, the nation, the country, which supersedes which and which is better. There's no right answer, but if you're looking at it from a community point of view, we need to protect our ill and loved ones. We need to protect our elderly. And the only way to do that is to make sure that there is herd immunity. This is basic science. You can't argue with scientific data. In order to achieve herd immunity, a large proportion, about 80% is needed to be vaccinated. Then you get this herd immunity, and then there will be so few people able to replicate the virus that it will sort of stop mutating and stop replicating, and that's how you get COVID-free. Now, the alarming issue is that the latest reports that I've read is that only 60% of our population have actually signed up for the vaccination.
Yep.
So even if our government goes full gung-ho in this next 6 months, we still have not convinced the majority of people that they need to be vaccinated, and for good reasons as well. The current practice is that the government tells you which vaccine. The government does not tell you which vaccine you're going to get until the day you arrive and you see which batch you get. I'm no one to debate government policies, but I have been following very keenly some of the doctors from the private sector who have been advocating for self-autonomy in terms of choices when you're trying to decide which vaccine you want and where you want to get it from and who you want to get it from. Now, this is an interesting perspective which can tip the bell both ways. We are talking about commercialization of the vaccine versus allowing the private side to give patients the right to choose which vaccine they want. They are all interesting points which have been tabled to the government, but have not been approved yet. When I know more, I would hope to share more, but I'm leaning towards that side as well. Allowing the people to pay and choose which vaccine they want based on their own reading, based on their own choice, based on whatever they have read and whatever they want to. And if they disagree with what is being provided from the government, just like if you were to go to a government hospital and you disagree with the condition, you can opt out for private practice.
Thank you. Thank you for more insights from you, Dr. Anand. I think what is happening right now is it's not just the COVID environment that affected people well-being. It's not just that they are stressed because there is a COVID. They're also stressed and anxious because they are not sure how to get out of this COVID, right? What vaccines should we take? Is SOP enough? Just like Dr. Fadzil say, is the cloth mask actually effective? You see, there's a lot of question marks on what are the actual best practices, right? And Dr. Anand, just now you mentioned about the which type of vaccine should people have the right to choose what vaccines. You know, there has been a lot of debate about which vaccine is actually better, and a lot of people actually still do not have the trust or the courage, like you say, right? Registration is still rather low. What do you think is the biggest myth surrounding vaccination right now? And where can people get the right information to make an informed decision?
Okay, so this is moving away from the mental well-being topic, but I'm glad to share whatever I know. I'm also not an expert in virology and infectious disease, which is where the topic of vaccine comes in place. But from my readings and from whatever the little that I know, the biggest myth being proposed by the anti-vaxxers is that the side effects of the vaccine supersede the benefits. There are many reports coming out recently about the incidences from the AstraZeneca vaccine causing clotting in the brain and in the vessels. And I think there was about 167 cases reported in a population of about 2 million plus. So when you look at the ratio, there are a few things that we need to look into so that we can put everything into perspective. Smokers have a higher risk of getting clots in their brain. COVID-19 getting this disease gives you a higher risk of getting clots. The vaccine has a very low relative risk when you compare with the general incidence. But I still understand why people are worried. We don't want the numbers to go up and become significant before we decide to take down the vaccine. And very rightfully so, countries like Denmark have recently removed the AstraZeneca vaccine from their program, from their trial. And that sort of shook up the world a bit. But this is all new information. And what I tell you today may not hold true tomorrow or the next week. What I can say is based on the current data available to me, we in the front line and the healthcare workers, we were all given the Pfizer vaccine. I have completed 2 doses. I had mild fever, a bit of myalgia, a bit of weakness, if you would say. And after 2 weeks, I'm completely fine. And based on the reports, the Pfizer vaccine has one of the highest efficacies, almost 95% after 2 doses. And even a single dose has an efficacy of about 70%. The problem is that we don't know how well it's going to do when the virus mutates. And viral mutation is something that will naturally occur until we have vaccinated everybody and we have not allowed the virus to replicate. So it's a very difficult conundrum. But what we know is that even though the efficacy of the current vaccines are reduced towards the newer variants, it's not absolutely useless. It's not to say that it's not going to function. From 95% maybe, the efficacy has dropped to about 80–85%, which is still good enough to prevent you from getting severe disease and from mortality. So which is still, I would say, a good enough reason to sign up and get the vaccine.
Thank you for the clarification. And I think the reason why we address it is because it is the elephant in the room. You know, we can pretend, you know, no one is concerned about it, but that's exactly what everyone is concerned about. And that's causing them a lot of anxiety, a lot of stress. Yep.
Yeah, it's a valid concern. It's a very valid concern.
Mm-hmm. Okay, I only have one more question from the floor over here. So if anyone have any more questions that you would like to dedicate to the speakers, kindly type your question in the chat box so that we can address it. So the only question left over here with us is, do you think that the heavy workload in COVID would interfere with other medical services? For example, the treatment of heart disease, cancer, hypertension. Would COVID causes young doctors to be deprived of their training to become better doctors? So it's a manpower question. So yes, Dr. Fadzil, Dr. Anand.
Okay, as a young doctors, from my point of view, COVID, this COVID era will definitely causes very lack of practice towards our interests, our own interests. But that doesn't mean we have to stop right here. But it may take time, and hopefully that after this we can resume our best of interest, and together we can end this COVID. And regarding the other facilities, like what we're doing now, other hospital are taking care of non-COVID cases, as everyone knows, such as cardiology and other departments. So I'm sure KKM is doing the very best that we can to prevent this to be more severe than now. Yeah, that's from my point of view.
Thank you, Dr. Fadzil. Dr. Anand?
Yeah, I agree with whatever Dr. Shahir just mentioned. it's true that in the initial phases, care for other subsets of illness were compromised. But it's 1 year on, and I think I have to admit that the government has done an extremely good job in decantering the services to ensure that there's still continuation of care for patients who are non-COVID. For your cancer patients, for your heart patients, as you so mentioned, they can all continue their care in Putrajaya or in Serdang, in Selayang. They have taken over the load that Sungai Buloh used to hold. Sungai Buloh was the center for many different subspecialties like spine surgery, upper gastrointestinal surgery. It was also the center for many other conditions. But other hospitals have taken over and they have their own workload, and it has also increased. So I think everyone is trying to help out and try to make the situation a bit more tolerable. And we hope that we are succeeding at this point of time.
Thank you, Dr. Anand. So back to you, Rajiv.
Yeah, thank you, Terence, for facilitating. So I think we are coming to a close for this session. I want to thank Dr. Anand and Dr. Ahmad. I think very insightful. I think we also have this strong reaffirmation what we need to do, right? And I think it's the information I got is COVID is not going to go away very fast, right? We really need to take care of ourselves, right? And I think is we need to listen. And of course, there is this COVID fatigue, like you mentioned. We want to run out, we want to do things, but is it going to make worse or going to make it worse for others? We need to be caring about others. And I think is the anxiety is because of lack of knowledge. We do not know what to do. And I think from the perspective of this whole initiative from the National Coalition of Mental Wellness, our calling is to help you in these areas. We will later give you call centers. We will start posting things on the Facebook where you can receive information and you can contact us. And so I really appreciate what you have done today, especially taking time to be with us. And most of all for serving the hospital, serving the nation, right? And let me pass to our facilitator, Sharvina. Back to Sharvina.
Right. Thank you, Rajiv. And thank you so much to both our speakers for your very, very insightful sharing. And now that we've heard extensively from both of them, can we have the final poll up, please, to conclude?
Sorry, Sharina, I'm not able to run that poll now.
Are you not able to?
Yes.
Okay, no worries. In that case, I would like to invite Dr. Vinogiri to come on board and invite and thank the speakers. Hi, Dr. Vinogiri, are you there?
Yes, I'm here. Can you hear me?
Okay, wonderful. Yeah, we can hear you.
Yes. So thank you very much. Today was truly fruitful, and it's actually like an eye-opener for all of us because we were getting insights from Dr. Anand and Dr. Ahmad. So like as a healthcare worker and also as a healthcare worker who had experience being infected. So I think at this point we are already above a year now, but there are still so many unknowns and uncertainties at this point. But we have vaccine rollout. That's a whole other thing. But I think at this point, we are still learning many things on a daily basis on how to survive this whole pandemic because it's totally a new norm. And people are definitely, they're not breaching SOPs in purpose. Sometimes it's just that they're so terribly tired with all these restrictions and they just want to get out for one drink or one meet. And sometimes things happen, right? The 1 second you remove your mask and then if you're wrong place, wrong time, things happen. So I think discussions like this is very, very important because we get to actually motivate each other. How do we fight this together? Because mental health is an outbreak by itself. It has been there all along. But one thing we can thank COVID-19 is, because of COVID-19, we are seeing the depth of this mental health, as in the issues and everything. So with this, I would like to thank Dr. Anand. Thank you very much. Very, very important information you shared with all of us. And Dr. Ahmad Fadzil, thank you, because to hear from a COVID infected person how you fought this and how you stood strong despite being in that situation is actually motivating many others out there. So thank you to you. Thank you, Dr. Dixon. Thank you, Ms. Sharvina. And thank you, Mr. Rajiv, for having this whole session. I think it's a huge success. And yeah, God bless all, and hopefully we fight this together. Thank you, everyone.
Thank you.
All right, thank you so much, Dr. Vinogiri, for that. So, and as we are nearing the end of the session, we would like to commemorate this moment by taking a group photo. So feel free to pose as crazily or freely as you like, but don't be too surprised if you are highlighted in one of our social media pages. But if you're okay with that, then just feel free to go ahead. Oh,
The poll
looks
is up.
like poll is up. Oh, okay, wonderful. So the poll is working now. So for the second poll, the question basically is, oh wait, you're not able to answer. It says it's closed here. Okay, great. It's working now. So the question is basically, since we've heard extensively from both our speakers on coping with anxiety, stress, and depression, so how helpful was this talk in providing helpful insights and methods in coping with the aforementioned illnesses and probably the negative effects of the COVID-19 pandemic? So that's great. A majority of responders are saying that it's very helpful. Thank you so much for that. We're very glad to hear that you guys got a lot of information from this talk and you found it very beneficial in learning how to cope and possibly using that in your everyday lives. Right, so I think, yep, the polling is closed and that should be it. All right, so now we can proceed to take the group photo. All right, so everybody just smile or feel free to pose.
Yes, I appreciate if you can just have your video on as well.
Yeah, just turn on your videos.
Okay, done.
Okay, thank you so much. And Dr. Dixon, can we have the slides up, please? Thank you. So as we've heard, these are very tough times. Everyone may be going through something, which is why it's very important for all of us to be kind and understanding towards one another. And unfortunately, we're not out of the woods completely yet. The pandemic has yet to see its end of time. And yet there are even talks of an imminent fourth wave. So if you're feeling emotionally distressed, we have featured a few helplines here that you can reach out to for emotional support. The first one is the GEM helpline. So their contact details are listed on here, and they operate on a weekly basis from Monday to Friday. Their afternoon portion is from 2 to 4 p.m. and their evening segment is from 7:30 to 9:30 p.m. So feel free to call in. Our second helpline is Befrienders. I'm sure that most of you are very well acquainted with this name. They're very famous in providing emotional and psychological support. So once again, these are their website details. You can find their contact information listed on there as well. And you can even email into them and they will respond to your queries. Right. So next slide, please. All right, so usually the facilitator invites the next moderator to talk about the next mental health talk for the next month. And seeing that I'm currently the facilitator for this session and the moderator for the next one as well, looks like I'm gonna have to invite myself, but we're not gonna do that because you'll probably cringe at my lame attempt at comedy. So I will just cut to the chase and So thanks to the sharing from both our doctors, we've seen how the COVID-19 pandemic has such a huge negative impact on our psychological health and well-being in the workplace. Now, of course, we've only heard it from a frontliner's perspective. What about the general public? You know, we have heard of increasing accounts of burnout, stress, and just basically negative coping that's associated, ever since the whole pandemic hit. And, with work from home that's vastly implemented now, where exactly are the boundaries? So that's exactly what we're trying to unpack and untangle in our next talk. And we also try to address some of the solutions in how we can better promote mental well-being in the workplace, especially now that remote working is such a huge part of our lives. So I look forward to seeing all of you there. The date is on 20th of May. It's the same time, 8 p.m. And the link is also featured on the slides up here, so you can take that down. And I really look forward to having you all join us then. So thank you so much for attending today's session. It was really great to have all our participants here. Thank you so much for taking the time, and to our speakers as well for providing very, very insightful insights and sharing their personal experiences. So thank you so much, everyone, and have a good night.